Welcome to today's session. We are going to be working on your lower back pain. Now, this is day 9 in the Getting Back in Shape Without Pain series. So if you haven't checked out the first 8, then make sure to do that after this one or before this one. Doesn't matter, honestly, because they all kind of work together. Those are all more for full body work. But I've decided to kind of do a little more separation, and this way you kind of pick and choose which ones you want to do for your situation. And today we are doing lower back pain. Now, this is an hour-long treatment, roughly. Just kind of depends how long you do the exercises specifically. But the idea is to simply follow along with the timer provided that you're seeing. You got 15 seconds here. And all we're going to be doing is just following along with that and chit-chatting as we fix our lower back pain, especially before the New Year's, right? The first thing we want to do is release the erectors. Now, we have 2 minutes to do this, which means we can work on one side at a time. So we are going to work on one side at a time. Let me correct that. But the idea of this is that you are simply just looking for the most tender spots, and then you're going to try to work it. You're trying to work it out, basically, release it. And the idea of this is by getting rid of all these tight muscles, those exercises that are supposed to help you with your pain, those become a lot easier. Now, of course, you just go straight to the exercises that we do here, which is going to be for the core. We're doing like about 5 different exercises for the core. But I find a lot of people have issues doing that because they can't really feel the muscle strengthen. They can't feel it wake up, right? Or they get pain whenever they do it. So if that's the situation, then you definitely want to release some tight muscles first, because chances are that's holding that tension down. So when you try to contract the other muscles, it becomes harder to contract and you feel the pain, basically. Try not to ramble here too much while I was trying to focus on my own erectors. And again, those are the muscles right next to the spine. Right now I have a small ball underneath there. I started off with the bigger one, the gray one, which is soft foam roller. And now I'm doing a little more of a targeted issue here. And I'm just trying to work it until the timer tells me to change sides. As you can see, this is all we're going to be doing here. We're going to do some releasing. Sorry, let's try that again with the mic not covered.
Sides for 10 seconds.
Hold on.
3, 2, 1.
So now it tells us to change sides. So let's change sides.
Release the erectors right for 2 minutes. 3.
And as you can see, just following the timer here, we can just relax and go through our own treatments at our own pace. So you can either follow along with me, just talking, or you can follow along with the timer and ignore my ass. Yeah, so why am I doing it this way, right? I know a lot of people kind of just go straight to the strengthening portions, but we need to massage out those tight muscles before we can do really anything else. And it's not really the muscles, it's more the fascia around it. Because if you don't massage out those tight muscles, the fascia, which makes muscles tight basically, it's called the myofascial system, which is muscle plus fascia. If you don't release it, then there's tension in the other side of the body, which then creates pain and creates weakness in other muscles. Wow.
That's halfway.
And that's why by releasing all these tight muscles first, which yes, takes longer in the beginning, but the results are so much faster because we're actually working on the entire body as opposed to just one piece of it. And that's kind of the sad part too with the doctors and healthcare system, unfortunately. And most massage therapists, don't get me wrong. But the idea is that most people kind of just only stick to their lane. And I get why, right? If you're a physical therapist, you're only going to be doing exercises mostly. And if that doesn't help the pain, they kind of send you to another thing, maybe chiropractor for adjustments, maybe some injections to help with your pain there. Not sure. But the point is, they will go and send you somewhere else. And that's kind of the problem, right? Because when you have pain, it's not just one issue or another. It's most likely multiple issues, especially with chronic muscle pain. Yes, there's weak muscles that's supposed to be helping support the body. But the way the body works is if there's a weak muscle somewhere, there's probably a tight muscle as well. When you contract the biceps, that tie-in that gets stronger, while the triceps automatically get weaker. And if you're a physical therapist, you're like, okay, I want to strengthen that side. Lower back pain. So we're working on the QL. I like to use the cane here, push into the lower back, and then I angle it. I twist into it to try to get a little bit more leverage with some pressure, and that's going to help me work on those deeper QLs, or at minimum, at least working on the lateral side of the erectors now, right? So if you think on the outside erector, you got to remember it's not a flat muscle. It's kind of like a tube.
Up next, swap sides for.
And you're trying to hit the edge of that tube and get right below it to get those QLs. Ooh, it's tender. Shit.
Release QL. Right.
All right, let's get the other side.
3, 2.
Let me change this up here.
Release QL. Right.
And again, I'm just going to push into that area and then rotate it. You can also do this on the wall with a smaller ball. I said in that case, you go in at an angle and then you rotate into it. But the massage cane is so much easier. So, like I was trying to say earlier, I think I lost my train of thought. But because most doctors and most professionals in general for body work stick to their lane, they usually only look at one path for a solution. But the truth is, it's multiple, there's multiple things happening in the body.
2.
So lower back pain, for example, you have tight muscles creating tension, but you also have weak muscles that's supposed to be supporting the body.
For 2 minutes.
A lot of ball here. That's what this is.
2, 1.
And we're just going to lay on our stomach, 2 minutes on one side at a time. I'll actually start on the left side so I can kind of face the camera here. And that's kind of the problem, right? That's why a lot of therapies don't really work immediately, at least. Or they work, but then they kind of, your pain comes back, right? It's because a lot of people are trying to address pain by only going one route at a time. And again, like I get it, you want to go one route at a time. It's very scientific. It gives you an answer. But you can't call the body complicated and then only try to treat it one way at a time, you know? That kind of doesn't make sense to me. So instead, we're doing multiple therapies here to try to balance the body out, right? Yin and yang approach, pretty much. Release tight muscles, strengthen the weak muscles. And by doing both, we get to balance the body out as opposed to only just attacking one aspect.
Exactly.
And in the middle, we do some mobility later on and some stretching, which is kind of going to help restore the tissues as well. So all that rambling and all that kind of just tells you what we're doing here. We're going to release a bunch of tight muscles, including our stomach, right? And the psoas underneath it. Right now, we're just trying to loosen the tissues in the rectus abdominis and all that, and then we'll get into the psoas later. But after we do all the releasing, we're going to do some stretching, some mobility drills a little bit, and then we'll get into some core training, and then a nice little recovery phase with some more stretching and foam rolling. So yeah, that is the plan. There's a hole in my rug. Shit.
Up next.
I must have cut that by accident. That's like a nice
3.
slice. All right, on this side, once again, just kind of lean to the side, hang out on that Pilates ball. And you're just now just hanging out there. By stretching out this way too, you're able to stretch the tissues out and then just slowly sink into it. And if you can just kind of focus on taking big, deep breaths in this area, you're going to help everything relax, right? This is helping the superficial fascia, the erectors abdominis, kind of get used to us in this area. Because next up, we're hitting the psoas muscle. I know a lot of people are going to tell you, you can't hit the psoas. These are all people who've never honestly tried, or they're just ignorant and they tried once and they just didn't do it because they think they're perfect. It takes a little practice, it takes a little time, but you can very easily work on the psoas. And you don't do it this way, by the way. I know, like, excuse me, got something in my throat. Let me get some water. So, honestly, I lost my train of thought real quick. Let me see. Where was I? I honestly forgot what I was talking about. Oh, well. If I figure it out, if I remember. Oh, see. Oh, yeah, releasing the psoas. Shit. I remember, see? Let's got to talk a little bit. So, releasing these psoas. People try to tell you because you got all those core muscles in front, you can't release it. They'll tell you because you have all your intestines in there, you can't release it. And it's because it's a deep muscle, you can't release it. No. No. Your core muscles are super thin, first of all. Very thin. And then, because you can get through that thin tissue, especially if you're not going directly into it, when you're going from an angle, the intestines are not like locked down to anything, right? They're not like muscles where they can't really move. They move very easily. As long as you're not pressing hard and going gentle. So as long as you press gentle the stomach, your intestines will kind of just get out of the way of the pressure. 3, you can literally feel the muscle contract when you think you're on it by simply lifting the leg, right? Where's my small ball at? There you are. So here, what I'm going to do, place the ball on the edge of the abs, place that block right there, and I'm going to press in at an angle, very gently starting off. And I'm just looking for a nice tender spot. I'm starting below the belly button. And again, I'm on the corner of that abs and then just pressing straight in. So by doing this, and when I think I'm on it, I can lift my leg up while applying pressure. And oh, shit. And I can feel it contract right underneath it. You'll feel it bulge up. You will feel it get kind of worse, basically, the pain. And that's okay, because that's just a way to quickly find it. And the reason why this works is because this is the only muscle in the stomach that flexes the hip. And it's the easy way to confirm that you're on it. You don't need to be touching the fucking thing. You can be pressing on a few muscles above it and still affect the psoas. And again, we're not trying to work the psoas. We're just working the fascia more than anything over it. And that's why we do things like pin and stretches, what I'm doing now. You pin the muscle down, then stretch the leg. That's going to stretch the muscle out. That's going to help kind of loosen the tissues. You can do some micro movements if there's any trigger points in the actual muscle. Right? There's all these little things we can do to release these tissues. And yes, it's painful in the beginning, especially if you've never done it. But so is fucking exercises. That shit hurts. It sucks, especially when you've never done it. But after a while, it gets easier. After a while, it gets easier. And the best part about this is you don't need to do this once you're like out of pain, right? Once your tissues are back to their original quality or better quality. The idea of this is temporarily. And the idea of the exercise, though, that's the forever thing. That's the stuff you should be doing every day to prevent your pain, But the moment you're in pain, it's going to take a long ass time for your exercises to help you get out of pain, if that makes any sense. So if you want to speed it up, if you want to go through a little bit of pain, you're okay with it, you need to massage out the tight muscles first. This one's tender. Oh, that feels good though. If you ever have hip pain or like back pain standing up, kind of, right? Especially from a long time sitting down, it's most likely this deep ass muscle because it attaches directly to your spine and the hips. And when you stand up, your feet are anchored to the floor. So when your spine now extends, it stretches that muscle. So you have that pain in the lower back because it's on the lower back spine. That one was sloppy. There we go. And again, try to take big, deep breaths while you're in these positions. I know it's difficult. I get it. I 100% get it. But it will help the nervous system relax just a little more. Ooh, this feels great, though. All right. Oh, I think that side's okay. My right side was a little worse than my left one. Then I got one more muscle we're working here. That's going to be the quads.
Change for 15 seconds.
And we're just going to roll it out. I'm using my harder foam roller for this. So let's get started. The idea of this is, again, the psoas and the rectus femoris kind of attached to the
Left for 2 minutes.
ASIS, which is the front hip bone
1.
area.
Release squats left.
And with that said, if these muscles shorten, they will pull the pelvis down, which tilts the pelvis, creating like an anterior pelvic tilt, basically. But just having the tension in these muscles from the fascia alone, that can actually translate to the other muscles behind them, like the hamstrings, the lower back becoming, or at least feeling like they're tighter than they should be. So then you feel that pain, you try to work on that actual muscle, and it doesn't work because that's not the source. That's where you feel it. I hope that makes sense to a lot of you. Let me know in the comments if it does. So here I just found a nice spot. I'm kind of just trying to warm it up a little bit, but I'm also just trying to find the worst feeling area and just work that area specifically. If you just start working one spot at a time, doing this a few times a week, in no time, you're going to be pain free. That's the whole point of these videos too, just to help you get out of pain by yourself. I get it's very difficult to rely on doctors. Don't get me wrong, I learned a lot of my shit from doctors. But I think our healthcare system, honestly, is what fucks us more than anything. And it fucks them. Like, it limits our doctors to do anything better. So then their treatments are very limited to only what they specialized in.
Up next, swap sides for 10
And that's kind of the beauty of not being a doctor almost. You're not like legally required
squats right for 2 minutes.
just kind of, I guess, do that. I don't know how to explain it really.
Squats right.
But it's like there's so much more restrictions when it comes to being like a doctor or something like that, right? But the thing is, as long as we're doing shit that isn't piercing the skin, isn't taking drugs, isn't, doing anything that could hurt yourself, like high velocity manipulations or something like that, right? Then you can use all these different therapies, which is pretty much common among most of them, right? You can do all these and it will work for the most part. I just found that my results and the results of others, honestly, have gotten much better when you combine all these different modalities into one, because now you're addressing the different problems at the same time as opposed to one at a time. I feel like, that's one of the problems. We try to do one at a time. And I get, again,
Exactly.
you try to rely with your research and your studies, but that's a flaw to a study. Not all solutions can be solved by just one thing, basically, right? It's not just X solves Y. You might need X, Y, Z to solve the Y, whatever the fuck the other one is now. Say A now. But that's kind of the idea of it, right? That's where it kind of screws us. And with bodies, very specifically, there's too many X factors to be reliable. Like, yes, you can say exercises help pain relief. That's great. But you can't really say that the pain stayed away for a long time. And you can't really say that
Change for 30 seconds.
it would have been faster or better results if they didn't release.
1.
And again, the idea here is that I'm actually going to stretching right now. So we're done with the release phase, actually, before I keep talking and rambling. We're done with the release phase. Now we're going to the stretching. We're just a few muscles out. The idea here is to help them elongate. We want these muscles to stretch out. So let's stretch out the quad since we're already in this position. And all I'm going to do is put my leg right there back and lean back to get a good stretch. For some reason, this was not talking, but the other one was. That's fine. So I'll just figure out what I was saying again. I do that a lot. I forget what I'm talking about. I start talking about something else. Let's see if I can figure it out again. And I was rambling about something stupid, probably. That's why I'm probably not remembering it. Yep, I remember. I know something to do with the healthcare system, probably, and doctors, but I can't remember exactly what it was. But yeah, anyways, I think that studies, wasn't it? Damn, did I remember it now? Studies. Yeah, studies are great. Studies are great for giving you very specific answers, but there's no such thing as a specific pain or specific cause when it comes to something like lower back pain or muscle pain in general.
3, 2, 1.
It's more multiple factors that still honestly create a pattern.
For 1 minute.
It's just harder to see it when you have a lot of
Stretch.
X factors thanks to people's lifestyles and the way they grew up and their experience and things like that, right? I think that's what I'll try and go at, right? We need the studies because they tell us individual answers. But when it comes to something like this, it's a lot harder to get right, to be consistent because of all the X factors in people's lives and all that, right? No one's going to be exactly the same. That's a big thing with posture, right, too. Because there's no specific, like, perfect posture, right? Like, it should be at this angle or whatever. They try to argue that bad posture is not a thing. And I'm like, well, yes, bad posture is a thing. We still want an optimized skeleton because that's going to optimize our movement patterns and that's going to prevent muscles from getting weak and that's going to prevent muscles from getting tight. And that's what then leads to chronic pain, right? Just because you don't have pain at the moment doesn't mean you won't have pain later on. And like, I don't know, that was one of the things that I always noticed too. Like, if you're on the camp of your posture doesn't create pain, I don't know. I do think it does. It does contribute to it, right? When our bodies can be fixed in a mechanical sense, mechanically, right? When you pull one muscle, the joint moves and the other joint shortens and all that, and the way it works, you can actually think of it as like, yeah, it is a posture issue. When you have too much weight from all of our typing and computers in the forward position, it adds stress to the back because now the back has to hold all of it up. At the same time, it shortens the front muscles, and those have to like hold it up almost, right? And that's what it does. And then you get tension, you get pain, you get TOS, you get things like back pain shit, right? That's kind of what happens. And it's because of the posture, it's because of the years and years of doing it. And again, you don't because people want a very specific answer, right? They want to know forehead posture is 5% here. Like, no, there's no such thing as that. No 5 degrees here, no 6 degrees here. It's all relative to that person. But for the most part, we should know that having your neck forward here adds a lot more weight than having your neck here. And that means more stress back here, more tension. It also means a cervical spine that is kinked more in one direction, right? It just makes no sense to me that people try to argue that. And then you still have those people who say your posture isn't bad, but yeah, they still have good posture, right? You will not catch them with bad posture, like doing their work, because they know it's detrimental to them. They just need a very specific study to tell them that this very specific number is your, like, no, that's not how the body works, people. Come on. We're all different, but we're all built the same. Like, our spines are all curved the same direction. Our muscles are all attached to the same point. Like, all that shit is the fucking same. And you can't argue that. Whoa. My knee. My knee almost gave out right there. It kind of hurt. QL stretch. How do I want to do this? There's lots of ways to stretch a QL. This is fine. Oh, I like this one.
Stretch Erectors QL left.
So all I'm doing here is leaning over and then leaning forward a bit, and I'm just trying to get it in the lats, but more importantly, the QL. There's better ways to probably do this, but I would have to set some equipment up. But yeah, posture does create pain. End of story. And again, if someone's telling you this and they're pointing to one study that they found looking at their specialty, that irritates me too. I remember seeing this. I forgot, I don't know what the hell he's not even a real doctor. He's like an osteotherapist, something like that. Something weird, right? Where you don't really need a doctorate, but you're still called a doctor. One of those.
Next, swap sides for 10.
I honestly don't even know what the fuck it's called, so I probably should be talking shit.
2.
What? When he tries to pull up researches about, oh, look, based on this research, you can't release fascia. But it's research based on his very specific studies, which is like the physical therapy side, like, basically. I was like, why don't you go look at a massage therapy like website, like Bodyworks Therapy, where it is like studies, legit studies by doctors that are physical therapists and other kind of doctors. And you see plenty results, plenty of studies that show you can release fascia. It's like they just only look in their field for an answer. And based on that, they come to a conclusion. I'm telling you now, fascia is the answer for almost everything. Ooh, this was good.
Up next.
All right.
Finish for 15 seconds.
Pretty sure. Oh, my. Wow. Chaos. What's happening? Spine extension. Okay. So, spine extension, you're just laying on the back, basically just trying to get a little bit of mobility in the lower back, T-spine. That's going to help a little bit.
Spine extension.
Now, for a lot of you, if you didn't know, if your lower back's hurting, sometimes it has to do with, geez, I'm trying to keep my ribs down as I do this. There we go. Feels better. But a lot of times when your lower back hurts, it has to do with actually tight hips, if you didn't know. That's why the next drill, we're going to be working on some hip mobility. But that's also why we're working on some T-spine mobility a little bit. Because if the T-spine or the hips, which is designed to be more mobile, if they become tight, they then become stable. Well, the lower back is meant to be stable. And the body's not going to go stable, mobile, or whatever the fuck, right? It needs to go in a pattern in order to keep that balance, that proper balance. So here we're doing hip rotation, 90-90s. Just focus on getting that mobility, try to get full rotation in both legs, right? Just going back and forth here.
Hip rotation.
So if the body doesn't have that balance, right, then it's going to look for it somewhere else. So in this case, if your hips or your T-spine get tight because of tight muscles, because of an injury, because of whatever, then they become more stable. So your body has to look for mobility somewhere else. And they look for that mobility in the next joint. And in this case, it can be your lower back or maybe even the knees. Does that make sense? Your ankles are a little more mobile. Your knees are stable. Your hips are mobile. Your lumbar spine stable. Your T-spine is more mobile, right? Kind of goes with the pattern. So if your hips become stable, the body's going to look for stability or look for mobility in the stable joints. And that's how we get a lot more knee pain and a lot of hip pain or back pain as well. So this is when we come up to the exercise portion after we're done here. And the idea of the exercises, I'm going to put them on screen, but we're just going through 5 different exercises. I'm not going to be talking through those. You do not want to be hearing me huffing and puffing. But I put about 20 minutes on the timer, you'll see. And the idea is I'm just going to go through these exercises as fast as I can without dying and trying to be proper, of course, with form. And when I'm done, I just start the next session, which will be the recovery phase. So this could be just a little shorter than an hour. But again, the idea is that we're just doing all of these mobility drills when we can.
30 seconds.
That's kind of the idea, right? I don't know what I'm talking about now.
2.
All right. So I'll see you in a little bit. I'm going to get some water, get my headphones, and get started. All right. Let's change it up. We're going to slow roll the quads. Get some air in here. Not too bad, not too bad. About 15, 20 minutes of workout, right? Don't fall. God. How you know this is unfiltered, uncut. All right, the idea of this is we're just slow rolling all of the muscles that we just kind of worked on. Give me just a few muscles here. The quads, the erectors. We'll do a light stretching, and then we will be done. So the idea of the slow roll, nice and slow. We didn't even hit the quads today, but we were slightly engaged, keeping us in position for some of these exercises. And we want to help relax the muscles a little more so that our pain doesn't return. Plus, it just feels nice. Let's be real. Hey, turn this music down. Way too loud. Not even a good song right now either.
Up next, swap sides for 10 seconds.
All right, you heard that. Swap sides.
2, 1.
Yes, masters.
Up next, single shots, right, for 1 minute. 3, 2, 1.
Oh,
Roll shots, right.
I swear every time I make a timer, it does feel like it's a nice trainer, you know? It just tells you what to do. Of course, you got a program, make it like that, but it just helps you not think about it. And trust me, as a trainer who used to make a bunch of workouts, I don't do that much anymore, but as someone who used to do that a lot more than I do now, it wasn't that much fun. Because a lot of times people want this 12-week program, they want these complicated workouts, and you got to help them keep it simple, and you got to help them realize that. So a lot of times your workouts are very basic and simple, but then you always got to change it up, and it's just a pain in the ass. I don't know. A bunch of different things, in my opinion. Erectors. Same as last time, just nice slow roll.
Up next, slow roll erectors, 1 for 1
Let me
minute.
put this on.
2, 1. Slow roll erectors, 1.
Oh, this feels good. And again, we didn't train the erectors. And idea now is that hopefully they don't engage again. Hopefully the core now prevents these muscles from firing up. And this is just kind of just a little extra reinforcement to help those muscles stay relaxed, at least for the next few days. Nice little sweat, though. Very tiny sweat. Ooh, it feels good.
Sides for 10 seconds.
Other side, whenever you're ready.
2, 1.
And now we're just working the other side.
Up next, slow roll erectors, right, for 1 minute. 3, 2, 1. Slow roll erectors, right.
So hopefully this is helping some of you. Hopefully maybe even a lot of you are starting to feel a difference already. Just by releasing some of those tighter muscles and then stretching, you'll probably feel much better. But if you want to keep those results, that's when exercise comes into play, right? Like exercise is king, no doubt about it. But if you want results faster, you need the queen. You need a massage. For sure, I've rehearsed that a couple times. That's why it sounded at least somewhat decent, at least in my opinion, right? Oh, this feels tight. Why are you tight? Oh, so my wife, her birthday's coming up. And even I know she's not going to see this until
15 seconds.
Actually, she might watch this
2.
on the day before her birthday. So never mind. I'm not going to say shit. I'll tell you the next one. Because I know she does watch these.
Up next.
But I don't know how much she pays attention, you know?
3, 2, 1.
So
Stretch blocks left.
we're going to stretch out the quads now. A solid minute stretching for all the muscles. A few of them pretty much, and then we'll be good to go. And again, this is just helping those muscles relax now. We're just trying to help those core muscles. And the way to think about it, we're trying to help the core muscles stay engaged, stay tight by loosening all the other muscles around it,
Exactly.
like the quads and the erectors and the QL. I don't know, man. I'm just in the fucking mood today. What am I doing? I'm switching the quads. Damn it. See, this is why I put a timer on. Because I forget myself. I don't keep track of time very well. I get distracted very easily.
Up next. Swap sides for 10 seconds.
You see, I have ADHD, but I was never diagnosed.
1.
I'm pretty sure I have symptoms of it, but
Up next.
like I said, that's a self-diagnosis.
For 1 minute.
That'll count.
1. Stretch quads.
Oh. Oh. So what's great about this little workout for myself specifically is it will help my disc golf game with my throws. Right now I'm trying to throw left hand backhand, which means I'm throwing like this, like a regular frisbee pretty much, but with my left hand. And it's weird because I am a lefty, but I throw with my right hand, the right hand backhand. I'm sure if you've never played disc golf or throw a frisbee, you don't know what I'm talking about, but imagine seeing someone throw, they usually do something like this, right? That's your backhand. But now for me specifically, my years and years of baseball,
For 15 seconds.
when you bat, you swing from left to right as a lefty. So it's a right hand backhand, technically, when you do it. So that just translated very easily.
Up next.
I'm gonna put my knee on this yoga mat or yoga block.
1.
So yeah, so my baseball swing lefty translates to a right hand backhand. So that just kind of translated for me very easily. So I'm very weird in that I putt lefty. I can do weird shots lefty a little bit, but I don't have very much power when I throw left. I don't have very much control versus my right hand that I actually learned how to play frisbee with my right hand, learn how to bat going that way, left to right, like a lefty.
Yes.
So now I have a dominant right hand backhand in frisbee, which is weird, or disc golf, which is really weird. I know probably most of you will not get this, like 1% of you. But yeah, I just find it odd. And this little workout, those little core rotations, great for me to start getting some power with my left hand backhand, my right to left rotations.
Swap sides for
That
10
helps.
seconds. 3,
What song is this?
1.
I'm so glad I put music on in the background too.
Stretch
It's a nice little distraction when I don't know what the fuck to talk about. Because I don't know if you don't know, but I don't know if you don't know. But if that makes any sense. Yeah, I'm just an introvert, kind of. We'll say that. If you met me in the streets, you'll probably think I'm pissed off for some reason because I have that resting dick face, RDF. You know, women get resting bitch face. I get resting dick face. Right? So I always think I'm pissed off all the fucking time. Luckily, my wife is very sweet. It looks very nice. So she countered that a little bit, but yeah, I got that resting dick face. I don't know why I'm bringing that up again. I totally forgot. Oh yeah, well yeah, I'm an introvert actually. So like not knowing what to talk about all the time. I hate talking about stuff, honestly. Like I'm forcing myself to really just talk and talk. It's just whatever comes to my mind. Honestly, it's weird. I'm not used to it, as you can probably tell.
Up next.
So yeah, having music in my ear is really nice, just to kind of distract me a little bit.
2, 1.
As you can see, my mind goes everywhere whenever. And Sometimes it's nice, sometimes it's not. All right, let's do a different stretch here.
For 1 minute. 3,
You get on all fours, drop one leg. I'm actually going to go this way first. I drop this leg, yes. So you just fold yourself up and then lean to the side, and then you get like a nice curve on that side, which then creates a stretch, not only in the QL, but the hips as well. Now, the only issue here, obviously, is to hold yourself up, but hopefully it's not that difficult. If it's not, just go back to that first stretch we did. But yeah, this is going to be our last stretch together for our lower back day. I hope you enjoyed it. If you'd like for me to talk about something, just leave in the comments. I could always use some more feedback, just random things to talk about as I'm doing these.
swap sides for 10 seconds.
Trust me, it's weird talking to yourself like that. All right. Other side. Sorry, I'm not looking at you.
Right. For 1 minute. 3, 2,
So this side feels tighter. Hold on, let me bend my knee,
right.
just so it feels a little better. If your knee feels weird, just bend it. And again, I'm just dropping my hips straight down towards the floor, trying to create as much of a stretch in that area as I can. I could probably even, come here, get some elevation and maybe get a little more of a stretch. Yeah, a little bit. I don't know why this feels harder though to hold myself up.
That's happening.
There we go. That feels better. Kind of sitting in my own shoulder pocket right now, but that's fine. I don't have any tension there. I'm fine. My elbow's okay. As long as you're not in pain while you do these things, that's what's best. Just try to get the stretch. Don't get into pain to feel the stretch, if that makes any sense.
One minute. Wait 1 hour. Follow 3, 2,
Cool.
1. Your timer is
Hopefully you enjoyed that. Let me know in the comment section. And next one's going to be wing scapula. So if that's something else you have, make sure to tune in for the next one.